Welcome to Connecting with the Toms podcast. I'm your co-host, Julie Tom, a trauma-informed movement specialist.
I'm Dr. Dick Tom, a biological medicine physician. We wish to share the untold truth about health and fitness industry based on our combined 70 plus years of experience. We want you to connect and feel empowered in your own mind and body by interacting with each other.
This show is about connection for you, for us, and for the world. This is Connecting with the Toms podcast. Let's start connecting. Welcome to another episode of Connecting with the Toms. I'm Julie, a trauma-informed movement specialist.
And I'm Dr. Tom.
And today we're going to talk about something that my mom has been using to help with her inflammation. Particularly, she's getting ready for a knee replacement soon. And she's been using something called, you might have heard, red light therapy or photomodulation therapy to help with inflammation around her knee. And also, I've been getting more and more interest on specifically Instagram of people asking me questions about red light therapy and actually asking for me to be an affiliate. So we wanted to do a podcast to share a little bit of the information on what is red light therapy and how can we use it to help our bodies heal from the inside out, particularly the brain. How can it help with inflammation and how it helps with the brain? So Dad, can you get us started with talking a little bit as what is red light therapy and why would I want to consider using it?
I think as a starting point, I think we'll give some perspective of sort of what's going on in society and what's going on within the world at this point in time. And it's well known that worldwide the elderly is the fastest growing segment of our population, and thus as a consequence of that, we're seeing increased number of cases of related cognitive and neurological diseases that are associated with aging. It's rare to find a person now who doesn't have a family member who doesn't have cognitive decline. Alzheimer's, is the name that people are aware of, but it can also look at things like Parkinson's disease. And what is I think we also know is that pharmaceutical interventions for these conditions have been less than stellar. They buy a little bit of time, but they don't really change anything about what the process is. So there are now, and have been for the last couple of decades, non-pharmacological interventions studied for the treatment of prevention. And since everybody talks about cognitive decline, is there something that you can do for yourself right now before somebody says, "Oh, are you aware that you forget this or forget that?" And so that's really what we're talking about with the idea of photomodulation, because it has been studied and found to be pretty effective in the aspects of the beneficial effects on that that can help brain function. And we're not going to limit it to brain function, but that's certainly an area that there probably isn't anybody who listens to these things who doesn't have some level of interest. And studies have been done on animals, but they've also been done on humans now for the last while as to what is really happening and what can photomodulation do. And interestingly, one of the things it can do, it can improve your production of energy through mitochondria. It also improves circulation and a whole variety of that type of thing that's going on. So, but people are looking for, will it improve your attention? Or can it improve your attention? Absolutely. Can it improve learning? Absolutely. Can it improve memory? Absolutely. Can it improve the mood? Absolutely. So, wow, who as the age wouldn't want to think that this is something that could be incredibly helpful and incredibly effective, for what's going on. So that's sort of an overview of why we're going to talk about that today. And just as another point of interest, without realizing it, the human beings are really a being of light. Every cell in our body emits over 100,000 light impulses or photons per second. And this light has been found to be the steering mechanism behind all biochemical reactions. So it's pretty essential to think that the light that we think about daylight, and light, the room is dark, so we turn on electric light. It's like, okay, big deal. Well, that's not the issue that we're going to focus on, because we're talking about light They're penetrating the body, getting at this to a cellular level, and actually having a dramatic impact on every single cell in your body, and the effect that that can have in so many things, not only to the cognitive aspect, but to improve homeostasis in every single cell. So we can start with that.
All right. That's a big mouthful, but
Yeah.
so in terms, well, for for me, I've heard about red light therapy. I've seen these red light therapy pens, and now very much in like the plastic surgery world, you see these people with masks. Like there's a on TikTok, there's a lady, she's wearing a red light therapy mask, and she's like dancing in front of her kid to be embarrassed and whatnot. And there's ones that go in your mouth, and there's some that go in your ears. And I'm assuming those are all for the brain. But I know, like, I'm particularly interested because for my mom is like, she's getting ready for knee surgery, and she basically commented on how much it's improving her inflammation. So it's helping her move better and get ready for her surgery. If I'm looking at red light therapy and investing in something for red light therapy, like you said, it's great for the brain, it's great for cognitive decline, but it's also good for inflammation, right? At the end of the day, that's what stress does. It inflames our body. So it's a great way to inflame it. So can you tell us a little bit about, is there some of the science, like what are we looking for? So if I'm going to buy a red light therapy device, what am I looking for?
Let's back up for a second. And the reason you're talking about red light is because red light is sort of the one that's is in the news. It's the one that people are aware of. But I want to requalify that obviously people are aware of a prism, they're aware of a rainbow. Every color has a specific potentially has a specific impact. I think the reason red light is more popular is because red light is now being promoted that it combats wrinkles and improves collagen. So it's like, oh my God, I'm going to look better. I'm going to get rid of my wrinkles, and I don't need to have a facelift and to get rid of these wrinkles. And I just go and I have the dermatologist or the esthetician, put a red light on my face, or I buy a red light, the one you just mentioned. She's wearing a mask or red light. She's trying to increase her collagen. However, I'm going to back up before we specifically talk about that. And we're going to look at the other colors that are part of the rainbow that also have an impact that can be, depending on the device that you have, can be helpful. So, if your only goal of getting a laser, we'll say, which common device, pen held or the little machine that basically produces red light, that's great. But, because we're really interested in a holistic approach, because we're interested in helping everything, let's just briefly talk about some of the other colors. For example, yellow light. Yellow light is also something that reduces inflammation. It can be used for sunburns. People always say, well, you need to slather on this other stuff, and it's like, well, you get a sunburn. Yellow light has been used effectively. If you use purple light actually has the ability to increase cell regeneration and a prolonged cell life, and which means that you'll be age slower and you'll feel better. The cyan light color is a pain blocker, and it reduces swollen capillaries. Infrared light, which is sauna, and that people tend to think about. It penetrates deeper into the skin, and it can be used to amplify the treatments of whatever somebody is trying to treat overall. We have orange light that also promotes, I will say, a better glow on the skin also. Green light is another color that's typically used, and it combats hyperpigmentation and sunspots. Blue light is you're using blue light and for acne, and that type of thing. So we have a number of different devices that are able to promote these kinds of things. Lasers, we've already mentioned. LED lights that people hear about that potentially are helpful. These SLD lights, which are super luminescent diodes. We have infrared lamps. We have UV lamps. We have diachromic lamps, we have fluorescent lamps, we have very bright light bulbs. So in other words, we got a lot of choices of, when we're talking about photomodulation, of what it's attempting to do and what we want it to do when we're attempting to deal with, a variety of different types of things. So, what is this light therapy really doing? So we talked about these idea of photons, and the cells need photons to produce energy. So light therapy has the ability to increase our energy packets called ATP significantly, which are basically is the energy of the cell. And from a science perspective, it's easily doing that type of thing. The colors that have probably been studied the most for many, many years are the red light, the blue light, and the near infrared lights. And the great thing about light therapy, it's been shown when used properly, has been highly effective and very safe. Which, when you get into pharmaceuticals for things, it's like there's so many adverse effects that ultimately are important. So when we look at the different colors, depending on what it is that you're trying to do, ultimately, we know that red light can penetrate about 10 millimeters, up to about 10 millimeters. A blue light only penetrates maybe at 3 or 4 millimeters, but then the infrared light can actually go up to about 800 into the bone. So significantly greater depth, depending on the different light color. And that's why we're talking about this whole concept of photomodulation. So what it's doing is it's supporting the cell to repair itself. It's allowing cells to regenerate themselves. It's obviously non-invasive. You just hold it near the skin, or you put it near your eyes or in your nose or your ears, and it allows the body to be able to penetrate these things. It's therefore has been used and is used for a lot of different types of things. As I said, anxiety, depression, SAD, chronic fatigue. People are using it for fibromyalgia, acute injuries, broken bones, the sore knee, the sore hip. In other words, tremendous variety of different types of things that are ultimately that is being used for. So that's that. We haven't even talked about what it's ultimately has the ability to do in the brain, but it has lots of ability in the brain itself. The increases blood flow, which just heat, as when you're out on a warm day, you tend to flush because there's more blood ultimately coming to the skin. We've obviously said that it reduces inflammation. It regrows cells. Your brain, obviously, it helps regrow to stimulate growth of the nerve cells, the neurons that are going on. It improves the connection between the neurons. Therefore, TBIs, traumatic brain injuries, is now being studied with the use of this kind of stuff. We believe it probably stimulates stem cells, which are the origin of every cell in your body. They have the ability to differentiate into whatever the body feels it needs. So it has a lot of incredibly helpful and effective modulation of what it is that we're attempting to do.
Absolutely. I'm like, why isn't everybody using light therapy? And the rainbow, like the fact I didn't even know like all of the different colors, but it makes sense because all different colors offer different things. Same thing with chakra energy. So, and we are energy. So now that you say that, I'm like, yeah, that absolutely makes sense. But before, like, I have a few questions. But so is there anybody that that should not be using light therapy?
I suppose somebody could look up. Off the top of my head, I couldn't imagine anybody. It's like saying, is there anybody who shouldn't drink water? Is there anybody who
Right.
shouldn't eat food? Is there anybody who shouldn't sleep? Probably not. And you just think about it. When do people typically feel better?
In
When
the
it's
sun.
sunny outside, or
sun.
when it's gray and overcast, and you're not getting the effect of pure sunlight for what's going on. Which is why sunlight is one of our most important basic treatment guidelines. Get outside. And if you can't get outside because it's a gray day, then get a light that basically produces
Hmm.
the same effect that you're getting from it. So since living in a dark hole, where you would never have exposure to light, of which there are some animals, like you think of fish and things
Hmm.
that live 5 miles under the
The
surface
oceans.
of the water. They obviously would have different physiology, but it makes no sense that we as humans, or animals for that matter, would benefit from not having exposure to light. So I couldn't possibly think of some, unless maybe it's something like an albino,
Mm,
directly, because they don't have melanin, and they would burn their skin pretty quickly. So that would be modulated. But and people who have different eye diseases, per
mhm.
se, the exposure to direct light. So, but that doesn't mean that they don't look. We know we don't look at the sun during an eclipse, because
Right.
it can have a dramatic impact on yourself, per se. But generally speaking, we're going to make this generic statement that light therapy, called sunlight, and now we're basically taking the parts of sunlight, we're breaking it up into the
Yep.
different colors and using them for specific reasons that they could potentially have in a positive way on the body.
Yeah, to heal. I like when you were talking about, I'm like, we're basically like plants just with more complicated emotions. So we all need sunlight. But you're right. But there are going to be maybe some nervous system disorders, but you said like albino, like people who are, with the light
Yeah.
sensitivity. So, there might be, there may be some considerations there for sure that, but yeah, but I agree that this light therapy can be more helpful to a larger portion of the population.
This is potentially another one of those type therapies that has the potential, because it's easy to source, it's easy to do. People can do it at home, but you make an investment of the unit that's going to be producing the light. It now becomes pretty evident that this is a potentially, in addition to the homeopathics and things that we do in the protocol, it could be extremely valuable, extremely helpful.
It's like nebulizing. It's been an add-on. It's like you learned
Yes,
you
it's been
learned
an
through
add-on.
after
Right.
yeah, it's definitely a definite benefit. So okay, like you mentioned that people can do it at home. So what am I looking for if I'm going to do it at home? Because I'm assuming like it's probably not cheap, because it's still relatively, I mean, light therapy has been used forever. Like before we
Yeah.
started the podcast, you talked about like the original light therapy that we've been using for babies is when they are jaundiced, right?
Yeah. You
So
put them in front of the window.
right.
Yeah.
So like light therapy's been around for a long time, but just with research and understanding and whatnot, we understand that there's way more benefits to it than we knew before. But what am I looking for if I'm going to outsource it? So do I go to a clinic or do it at home? And obviously, what am I looking for?
Well, I think, like anything, I don't think somebody should just look on Amazon and said, "Oh, here's a laser that produces red light, or some color therapy," and it's like, "Oh, let's buy that and let's stick it on our body." I will say that, as I said, light therapy is incredibly safe. There's a huge safety factor. Most of the stuff you're going to buy, I'm going to say, from like on Amazon or a non-professional source, it's going to be a high margin of safety, because those type of red light therapies typically are using wavelengths of 610 to 670 nanometers. So they only penetrate this but 5 millimeters. So it's just straight skin stuff. If you want to do some wrinkles and collagen, but if you want to get real therapy per se, you're probably going to need a professional device, which may have to be purchased through a medical clinic or some type of professional company, because to get the near infrared light, you basically are looking at something either 810, 830, or 850 nanometer wavelengths that they can penetrate much deeper, literally through the skin, getting even to the bone, which is where ultimately you can have such a huge impact on stem cells. You can have a huge impact on the mitochondria, huge impact on the body's ability to produce energy. So the devices that you can buy, even when you do the treatment, let's say for 30 minutes, when you go out in the sun, as I do, beautiful day here in Arizona, as it often is with sunshine, is that you get thousands of times more exposure than what you're getting, from the device itself. So what you're looking for is, I would say, is to do your research, find out, maybe speak with your physician or your healthcare practitioner who has some knowledge about this kind of stuff. If you just want to deal with skin stuff and are not necessarily looking at, the more important aspects of energy and the more important aspects of decreasing inflammation, there you're going to have to get a little more involved and probably look at a professional.
Okay, because I know I was looking into them. I talked to you about this a long time ago because I was like, do I get red light therapy or do I go infrared sauna? So, like I looked into, they have these red light therapy. It's like a board, and they're not cheap. So, and they're different, like you said, different wavelengths. So it all depends on, like, I guess what the purpose that you want to use light therapy for, right? So at the end of the day, it's like, okay, why would I want to use red light therapy? Well, I want to improve cognitive. I want to work on my cognitive decline, or I want to work on managing my stress, or like specifically people, like I have a happy light, for instance. So I have my happy light in the winter, like that's obviously giving me some type of therapy because I'm getting exposed to light. But like you said, the deeper stuff. So I am looking for, so if I'm doing the research, so I'm looking for a clinic that offers probably 800. I want at least 800.
Well, you're basically looking at a device that's going to deliver, the near infrared light, because we do know that that's what ultimately, for the brain specifically, you have red light and you have the near infrared light therapy, which can be applied directly to the head, so that actually can penetrate through the bone and into the skull. And we know that it does. That's when you're getting all these additional benefits from doing it. So if you shine it, put a helmet on, or you can have devices as a mouth guard, or you can ear clips or nose clips, we'll say, has the ability to literally getting into the brain, and we're trying to improve all these neural functions without adverse effects. That is such a positive thing of what it is that we're looking for. And we're not talking curing Alzheimer's, we're not talking curing Parkinson's. What we're talking about is improving quality of life, people who may happen to have that. But the preferred, obviously, in biological medicine approaches, do the prevent the problem from happening is actually the best treatment. And they still say the best treatment for Alzheimer's is to do preventive therapy. And because often medication is not applied until the person already is, unfortunately, in the throes of that. Now that we know that we have the ability to do all the basic treatment guidelines, and now we have it, I'm not going to call it a basic treatment guideline other than sunshine is our light therapy, the obvious light therapy. Now we can actually use devices to further enhance what sunlight is why sunlight is part of our BTGs for what's going on.
I'm almost thinking though, like people like in the northern hemisphere, like me, it might actually be more beneficial because we don't get as much sunlight as you. So, like
right,
doctors and naturopaths and chiros and wellness centers or whatever, like it may be something that you can definitely help your clinics if you have some kind of device for your patients to come in and do and stuff. So that's something that I'm definitely looking at exploring to add to my own, when I work with clients. And it's a healing modality at the end of the day. Red light photomodulation is another healing modality to add on to the list. And the fact that it's passive and that, like you said, that there isn't really any negative effects to it. Like you're only supporting yourself. So, like, unfortunately in this society, more people are relying on passive treatment rather than active treatment. So the fact that you can just show up, put on a helmet or put some things in your ears and, let it do its magic, it's going to help. It's going to help you in some way, shape, or form. So if you have that. So do you have a protocol that you particularly use? Like, I don't know what mom's protocol is. I know you put her on one, but is there a certain amount of time that I should be doing it for? Cause I know like with the board, like with the panels that I was looking at investing. So you get like 3 panels and you do 20 minutes aside is what this company suggested. Is that the same? That would be about 20 to 30 minutes. That would be the
30 minutes. The preferred, the most ideal is 30 minutes twice a day. And once again, when you're doing these types of treatments, it doesn't mean you're you are taking an hour just to do that, you're totally awake. You could be doing other
Hmm.
things. You could literally be reading at the same time, or educating yourself, or whatever it is that you're doing while you're doing this particular therapy. So 30 minutes a day would be the prescribed treatment, we would say, the ideal treatment. However, people say, well, do I have 30 minutes a day? Just think, you could do a castor oil pack at the same time. You could be doing castor oil pack and light therapy,
And deep
30 minutes,
breathing
and deep breathing. So
and
you
some
can be
self
doing.
massage and some lymphatic. Like,
So it's like we can easily take the 30 minutes for some self-care, and it's another tool that we can incorporate into, optimizing to try and get us to this point of optimal performance, improve quality of life, which obviously is what the goal of all these podcasts are about, and the goal of helping people feel better with themselves for what's going on. So that's always the ideal. Once a day is preferred, but as I say to somebody, if you did it 3 times a week, it's better than no times a week. If you do it
right.
once a week, that's still better than 0 times a week, in general. But the preferred, as per the company that's suggesting this near infrared therapy, would be 30 minutes twice a day. And if somebody is in the throes of already evident decline, they would highly benefit from doing the treatment twice a day. If you're doing it as a preventive, then certainly, once a day, and even like 4 times a week would be a great preventive therapy while you're doing your other therapies, as you just mentioned, as we can concurrently do multiple things all at the same time.
Right. But would I do that? Is this something that I would do like for the rest of my, is this like a sustainable type of therapy? Or is this something that I would do for like a month and then I'd be good? So that's why I could just like focus. I don't have to necessarily buy the device, but I can just go to a clinic that would have it.
The Well, it's like saying, can we basically get 30 minutes of 30 days of sunshine, and then I don't need sunshine anymore? No, light
No.
therapy is something that you need for forever, however you achieve it.
Right.
We know that people in the northern incline tend to fly into Mexico or Arizona or Florida in the wintertime, and then they bake themselves for 30 minutes or 31 week of vacation, per se, because they're so starved for that light therapy. So it's pretty evident that it's the kind of thing that's ongoing and forever. And yes, once you invest in the device, you have the device literally forever.
Yep.
So it's not a problem. But when you do maintenance of things, we're talking therapy of things versus maintenance. So if you may go to a clinic and get a sense of what the treatment is, and then you say, this is worthwhile investing in because I'm going to be doing this forever. I don't need to be coming to the clinic forever. But if I invest in something that I can do at home, I can do it in the luxury of my own home, on my own time schedule, et cetera, et cetera. So yes, I would say it's the type of thing that light has been a part of life forever. You mentioned plants. If the world went dark, we would all die, not
Yeah.
for different reasons, but so would every plant. We would have nothing to survive with. So light therapy is equally important to plants. And if you say, well, I don't need light therapy, do plants need light therapy? Yes, they do.
Yep.
We need light therapy forever too.
Right. I can tell you, we're basically we're plants with just more complicated emotions. Yeah. So it's essentially, so when I'm looking for the device, and like also like when you're, what am I doing when I'm using it? Like you said, I can do anything, but the idea is that you have to be, you can't do it with your clothes on. Essentially, it has to be on your skin, right? So I
Well,
think,
depending what you're using it for, said if we're using it for brain stuff, it's on your head, so we don't
right,
have
it's a
any
helmet,
issue per se. It's a helmet or the clips or nose type
right?
thing. So if you're doing it on your skin, for different parts of your body, not just your face, obviously you would have to apply it directly to the skin. Yes, that is definitely true.
Right. Okay. Yeah. So something to be aware of. Well, because like I'm just thinking for me, a big part of my healing that I work with clients is vagus nerve and lymphatics. So the fact that, like I could use a pen light, and do that, but it's going to take a while because the pen, you have to hold it there. And I know some people, they have the pen for their face, but a lot of times, like you said, most people the plastic surgery or the cosmetic industry has really taken off with the red light therapy, but this can be used for like mental health, right? Because you said it helps with energy
Absolutely.
and it can help with anxiety and it can be
Oh,
in the physical health. So with injury, like my mom getting ready for surgery, it can help with recovery of injuries. So does it matter? So if I'm using a device, does the what's the word I'm looking for? Like the wavelength that matters, right? So like you want to make sure that it's like at least 800 if I'm going to try to heal an injury versus
correct.
if I'm using it for anxiety, would that be different or that you're
No,
aware?
obviously, if we're talking about anxiety, we're looking at penetrating the brain.
Right.
The pen light is not going to penetrate through the skull because it's
No.
only basically the wavelength is too short. We need a longer wave. We need the longer wavelengths to be able to penetrate through the skull, through the skin and the skull, to truly have an impact on the brain cells themselves. So pen light is not going to do it for anxiety. Once
Mhm.
again, the pen light, that type of, you can buy
That's
on Amazon. It's going to be skin stuff. It's going to look good. It's cosmetic.
it
The
helps with
lasers that
wrinkles.
you get, it helps your wrinkles.
Yeah.
And that for some people that's a big deal. It is a big deal.
Sure.
Not to deny that. So it makes people's sense of self-worth. It's like, oh, I'm prettier.
Absolutely.
Makes me feel better.
Self-image.
So self-image is a part of this. But as a physician, I'm wanting to, that's great, but I want something that's more lasting and has potentially a more long or deeper acting effect on a much greater physiologic approach of, because who doesn't want more energy? Who doesn't want to sleep better? Who doesn't want to just think better? Who doesn't want to have less improved focus and concentration? Who doesn't want to have better mood, etc.? So it'd be hard pressed to think, oh no, somebody said no, I don't want that. It's like, no, of course everybody wants to feel better, so of course you want that.
Sure. Do you know, are there any side effects that you know of?
I guess potentially, if you there's no side effects when the device is used as prescribed per se, but we know in this society, if somebody says, well, 30 minutes is good, it must mean 5 hours is better. It's like,
Right.
no, not
Moderation.
necessarily. Moderation, use as per the manufacturer's recommendations and suggestion. Can you overstimulate? Sure, you can overstimulate. Somebody going to the gym for the first time says, oh man, I can lift this. And it's like, oh, this 5 pounds is nothing. I got to try 50.
Right.
So yeah, it's like theoretically, if you could bench press 50, it's better than 5, but not necessarily physiologically. So moderation, common sense, like anything, I think needs to be part of the utilization of these types of tools.
Well, like, and everybody might, like not everybody's going to respond the same way because we all have different nervous systems and different, things going on in our bodies. It's just like, I'm just thinking about a client. We were talking about castor oil this week, and she's like, how do I know it's working? Because for some people, like we talked about in our podcast before, is that some people it actually like it stimulates them, it gets them going, and so that's why it's like, when's the best time? Well, I'm like, not if it stimulates you, not before bed. So like for me, it makes me sleepy, so it totally engages my parasympathetic nervous system. So light therapy, how do I know it's working? How do I know it's working? I know what you're going to say, but I'll let you answer it.
A lot of That's a great question. And I would say the person who will notice it most is your partner, the person you're around the most. Maybe it's your coworkers, maybe it's your kids, because they'll note that you don't repeat yourself. They don't ask you to repeat as often, or you're not sort of, what's that word? What's that word that I'm searching for? You're not sort of asking those around you for that type of thing. And because I see this in my patient population so often, especially when I'm talking to a couple, one the patient per se is doing the talking, and then the partner will kick it. No, you don't do that as much, or you don't say that as much, or that and they say, oh, I hadn't noticed. So very often you don't notice it yourself. It's the person who observes you the most and probably will pick up before you will that this ultimately. And the reality is, it's going to work. All you need to do is do it. It's not like taking a medication that for a high blood pressure and say, well, that didn't work. You need to
Right.
try a different one. Light therapy is, for all intents and purposes, it's a basic treatment guideline called sunlight. Now we're basically taking parts of the sunlight and
We're breaking it down.
directing it into a specific purpose per se. So if you'd said sunlight didn't work, then I could say, well, the light therapy won't work. And it will always work. You just have to do it.
Well, as I told my client, I'm like, this is kind of one of those trust factor things. Like, if you don't necessarily feel it, you just need to trust me that, like I have your best interests at heart when I suggest different treatments. And so light therapy is definitely one of those that follow along. It's kind of like castor oil and nebulizing. It's not going to hurt you. It's not, and well, I tell like castor oil. It's the only way it'll hurt you is if you actually ingest it. Please don't ingest it. Like, you don't want to be doing that. But there's so many amazing benefits to light therapy, to like all the basic treatment guidelines, like sunlight and whatnot. Like, if you struggle with depression, if you struggle with anxiety, if you struggle with stress and overwhelm or cognitive decline or have an injury or have inflammation in your body, like it's going to help. So at the end of the day, is this the modality that you're going to choose to use? And the people, so you're saying, just, is this, there's more research that's supporting this, I'm assuming?
Research has actually been out for about 20 years.
Oh, okay.
So that they've been working with it. Just like some medications have been studied for years, and it's like, but it's become. I think the reason it's more popular is because once dermatologists and once estheticians started getting into laser treatments for skin, suddenly people started to hear about it. Now it's coming out that, well, actually, it has a lot more positive benefits than you're thinking about just for skin. And as a physician, yes, the skin is important, but more importantly is what's happening deeper inside. We know that, health is more than just what's on the skin. It's really it's your core, what's going on inside all your organ systems. That's what we're trying to find an additional support, as opposed to thinking, is there another medication that would benefit me? What we hope we'll find as time goes on, that people will find that they'll need less medication because they'll be able to do more self-care by taking the basic treatment guidelines, utilizing them as part of their everyday routine without thinking about them. And so light therapy, just like we say, get out ideally 30 minutes a day in sunshine. And if you don't have it, use a happy light or some form of, light therapy to support what the sunshine is basically doing for us on an everyday basis. And this is something that's 365, and it's for the rest of your life. That actually has a potentially dramatic and positive impact as we get older. So there's no downside to photomodulation.
Right.
And it's just a fancy word for light therapy. It really is.
It really is.
Talking about. Yeah.
Just give it a try, people. Just find someone that has one, or, find a therapist that has it and go from there. So something that I want to add on, I've been talking a lot about scars because I work with a lot of people with movement, and scars are a big piece of the puzzle in terms of emotions that get trapped in the body, and the fascia gets really locked up. And light therapy is a fantastic way to help you manage your scars. So, because when you are able to release the scars and release the energy that tends to get gummed up in there, if you will, it's a fantastic way to, and it's like, it helps you just move better, right? At the end of the day. So just something that I want to add on, because if like I said, my world, people who want to move better, they're very stiff, they're very sore, they sit here and stretch for 20 minutes a day. I'm like, try stretching under a red light therapy, or a red light, or not necessarily red, under a light therapy, like whatever lamp you want, depending on what you're looking for. That could definitely have lots of benefits for you. So so I think that's pretty much answers all the questions that I have. Do you have any other things that you want to add on today?
No, just to reemphasize that this is one of these therapies that have been around since we have been on the planet, since the planet has been here for tens of millions of years. Every plant, every animal species that has ever walked on this planet has had the benefit of using light therapy. So anything that has stood the test of time, which this has to be beneficial. But just don't be don't get sucked into, well, this red light, because it's $10 cheaper than that one, may necessarily be doing the trick. Know what the reason is that you want to use it for. If it's straight skin, you won't have any trouble. If you're truly looking for something that has a much longer lasting and much more effective treatment, you're going to need something probably.
We want to remind you that knowledge isn't power. Applied knowledge is power, where knowledge turns to experience. We encourage you to implement the information shared, allowing you to shift your energy from head to heart.
Do you have an idea of like price?
If this is your first time listening, we would love for you to subscribe to connect and grow with us in the coming weeks.
Suggesting to patients to get started is
if you'd like what you've been hearing today, we encourage you to go wherever you're listening to leave a review. Tell us what you loved about the episode. Tell us which one was your favorite and share topics you would like us to talk about.
And you're probably.
And if you're interested in learning more about biological medicine, go to my website, drdixontom.com.
And if you'd like to learn more about how to shift your nervous system and heal using movement, I encourage you to visit phytomize.ca
dust magnets
to learn more. Thanks for listening, and we look forward to connecting with you on the next episode.
That has the potential to help you for the rest of your life. $4,000, let's say, is not a massive investment, because if you amortize that over the next 30, 40, 50 years, it's not a very expensive tool to truly improve your anti-aging, which a lot of people are sort of into.
Most of the things that when I look for like light therapy, it's all red light. They're all promoting red light. Do you know if there's any devices that actually emit the different colors, or do you have to buy each color separately? Do you know?
Now, I can't tell you the name of specific devices like that, but once again, you need to do your research,
right?
Ultimately, for looking, if you want to look at one type of device, look at cerebralfit.com. There's some great videos on there to reiterate the types of things that ultimately we're saying. So you'll be looking at a professional company that has tremendous amount of knowledge and opportunity to help and share, with your particular issue and your particular concern.
Okay. Yeah, because I'm like, the light therapy that I was looking at, the boards were between $1,000 to $3,000. So yeah. just for like price and stuff, but that was infrared light therapy. So
which is
pretty standard.
There's a variety of companies. Mm-hmm. Obviously, there's people out there may have their own sources of things that will be helpful. So the bottom line of this particular podcast is look into it. Light therapy has the potential of dramatically helping and improving your quality of life, anti-aging, but just even the fact that you'll feel better, have a little more energy, mood, et cetera, is well worth the opportunity to look into it.
May I just add that it's passive?
Yeah.
It's a passive treatment. And like, I don't know many people that like to give up passive, like you just have to sit there and do the thing. Right. Yeah. So like, not to perpetuate that kind of behavior, but it's going to force you to slow down. It's going to force you to, focus on your breathing, or read a book or whatever. So it's an opportunity for you to heal in a, relaxed state. How cool is that? So that, right there for me, it's like, that's a win, that's a win. That if I can slow down and it's doing some regenerating of my stem cells or my neurons, help me think better, all that stuff. So then I can remember where I put my keys. Cool. and I know how to write. Well, it's funny, like I know in one of our podcasts, kind of off the topic, but I'm seeing things now that like there's some research talking about that reading, and like you've talked about before, reading in a book, so good for, brain health and whatnot. But it's funny, like all the things that we've been, they have been good for us for years. It's coming back to the surface. Anyway, we are going to talk about the big C in the next podcast. We're going to be talking about cancer. It's been coming up a lot, and we want to discuss some ways to help you if you have a family member or anybody that you know that is recently diagnosed or has been going through cancer, what we can do to support them. And also if you are someone that has cancer or you've are post-cancer, what you can do to support yourself when cancer's part of your life. Is that right, Dad? Is that what you want to talk about?
That's right. We're not going to talk about treating it. We're going to talk about supporting it.
Right.
For what ultimately where an individual is at. So yes, it's about support for that. That is, unfortunately, there's one like dementia and cognitive decline. Fortunately, there's very few people on the planet who haven't been touched by a loved one or somebody that they know, a neighbor or whatever, who doesn't have. We know statistically it's 1 in 2 men in their lifetime and 1 in 3 women in their lifetime will unfortunately be diagnosed with cancer. And the American Cancer Society has said by 2050 those numbers will continue to dramatically escalate. So it's going to be not a universal disease at that point, but it's getting, by the end of this century, it wouldn't surprise me that it is a universal disease.
Right. So we want to be able to talk about it, because I think a lot of times when people hear the big C or they hear about cancer, we tend to get frozen. We get stuck in fear. Right. We don't know what to do. So we want to be able to offer you an opportunity to discuss. We want to talk about it, because it doesn't have to necessarily be as scary, because basically, I know you've told me this before, cancer is basically the body screaming at you that something's not right at the end of the day. So,
well, I tell patients that cancer isn't a sentence. It's simply a word.
Right. That's great. We should leave it there.
Yeah.
Cancer is not a sentence. It's simply a word. That's all. I love that. All right. So we'll talk about that in the next podcast. As always, we appreciate you. Thank you for the support. And if you haven't subscribed to my YouTube channel, I'm just going to plug it a little bit, because I'm going to be uploading all of our podcasts on YouTube as well, to make it easier for you to connect with us. If you have any questions, comments, concerns about any of the topics we have discussed, please send them in. You can check out how to connect with us in the show notes. But thank you again for supporting us. Please send this to any family and friends that may find this topic of interest and helpful to them. So thank you so much.
And just one more plug for the Begin Again Brain Protocol book. Obviously it talks about these types of things also that can be supportive for people and for the practitioners. If you're interested in learning even more about it, on May the 14th and 15th here in Scottsdale, or virtually, I actually will be teaching the course for therapists and practitioners on the brain protocol. If that's of interest, and you can find that information on my website, drdixontom.com.
Fantastic. As we continue, we're just going to keep touching lives, Dad. We're just going to keep plugging it. We're keep plugging, helping people get proactive and help themselves heal. Because at the end of the day, your body and mind are extremely powerful, and we're just here to help guide you. So that's awesome. That's awesome. So I'll put all that information in the show notes. If you have any questions about it, contact us. But yeah, hopefully get a lot of people showing up for that. That'll be good.
Indeed.
All right. Thank you so much for being here, and we'll talk to you next time.
Talk to you next time. Bye-bye.
We want to remind you that knowledge isn't power. Applied knowledge is power, where knowledge turns to experience. We encourage you to implement the information shared, allowing you to shift your energy from head to heart.
If this is your first time listening, we would love for you to subscribe to connect and grow with us in the coming weeks.
If you'd like what you've been hearing today, we encourage you to go wherever you're listening to leave a review. Tell us what you loved about the episode. Tell us which one was your favorite, and share topics you would like us to talk about.
And if you're interested in learning more about biological medicine, go to my website, drdixontom.com.
And if you'd like to learn more about how to shift your nervous system and heal using movement, I encourage you to visit fitomize.ca to learn more. Thanks for listening, and we look forward to connecting with you on the next episode.